Good evening. A new study finds drug overdose deaths have quadrupled in Indiana in the past decade. Indiana has the country's 17th highest rate of drug overdose deaths. Prescription drugs were blamed for over 700 overdose deaths in Indiana in 2011. That's a 10% increase from 2010. News 10's Patsy Kelly found out how the Wabash Valley is ranked. She has more in tonight's top story. Patsy?
Well, Patrice, prescription drug abuse is pretty high across the Wabash Valley and getting more common. And what can start as a helpful aid after a surgery or use as a painkiller can turn into a dangerous crutch. A prescription drug overdose can happen easily.
It's really a cinch because like any drug, you begin to use it, you build a tolerance up to that drug. An individual will not know what level his body can take. So he'll take so much that there'll be an accidental overdose.
Indiana is one of the top 5 states for fastest growing rate of drug overdose deaths. And Chances and Services for Use Brandon Halleck says he's seen that rising statistic in drug misuse across the Wabash Valley.
In Vigo County, in use or misuse and abuse of, for example, prescription drug use, is in one of the top 5 communities in the state of Indiana. And so that is one of our largest concerns right now.
One of the main issues, prescription medication is highly addictive and easily accessible to everyone, including kids.
A lot of times that's where kids will start with prescription medication, and then their addictions grow.
One of the biggest concerns is the rise in drug abuse among 18 to 25-year-olds. Officials say this is when you start to notice if someone has been abusing. Often abuse begins with prescription drugs, but transitions to other drugs, or vice versa.
Prescription medications are used in place of another drug. So an individual can't get their marijuana, they can't get their heroin, they can't get high off of methamphetamine. So they will substitute it with prescription medication.
The report suggests there are areas Indiana hasn't tackled. That includes expansions to Medicaid to cover substance abuse and a law to protect those who report a drug overdose. But Lewis says that tackles the issue too late.
That's not going to make a difference because those are after the fact. You have to figure out what causes the addiction first and then try to set up ways to prevent that cause and effect.
Halleck suggests you dispose of old meds instead of keeping them around the house. Many addicts get their first drugs from a family member or friend.
If their parents do have prescription drugs in the house, are they locked up? Are they accounted for? Do you know where they are?
Halleck thinks the best prevention is communication with your child on the dangers of drug abuse and addiction. Officials say they're working on getting a plan in place so the community could dispose of their old prescriptions year-round, more than just the buybacks from law enforcement. For more information on how you can get help with substance abuse, check out this story on our website at WTHI-TV.com. Back to you, Patrice.